Good morning. Thank you for joining us, and welcome to Advocates for Children of New Jersey's presentation of the New Jersey Kids Count 2026, the State of Our Counties report, which was released a couple of weeks ago. My name is Sue Flynn, and I am the Vice Chair of the ACNJ Board of Trustees. It is a pleasure to be with you all this morning. The 2026 County Pocket Guide is a data report highlighting trends in child well-being across all 21 counties. Areas covered are demographics, family economic security, child health, child protection, early learning, education, and teens. ACNJ has published Kids Count data reports for over 30 years with the support of the Annie E. Casey Foundation. Why does ACNJ publish Kids Counts data? Policymakers, elected officials, and government agencies need accurate data to make informed decisions about programs impacting children and families. Service providers use it to improve their responses to child-related issues in their communities. Grant writers use it to write proposals and seek support for programs that help children and families. We want concerned residents like you to use the data to become better advocates. Alina Siddiqui, ACNJ's data analyst, will now present a summary of data from this year's report. You will hear about data today, which shows progress in some areas and areas that continue to pose a challenge. Challenges that prevent every child in our state from living up to his or her fullest potential. Alina has worked with other ACNJ staff to make the data more accessible for both state officials and you, the advocates. So please download a copy of the report from the ACNJ website and share it with your colleagues, friends, and family members. Following the data presentation, Alina will be joined by ACNJ President and CEO Mary Coogan to take a few questions, which you can put in the Q&A on this video. Following the questions, former Assemblywoman Shavonda Sumter, who is now the President and CEO of Children's Aid and Family Services, will share her reflections on the data. I now turn the microphone over to Alina.
Thank you so much for that. I'm just going to share the slides. So, good morning, everyone, and thank you so much for joining us today. Today, I'll be walking you through some of the data featured in ACNJ's County Pocket Guide 2026. By the end of this, I hope you'll have a clearer picture of where these children stand across various measures and what the data might mean for the work that you're doing. Thank you, and let's get started. Before we get into the data, I want to talk about where we get the data. The data we use comes from publicly available sources, and we rely on both federal and state entities to provide comprehensive and accurate data. Some of our sources include the Census Bureau, New Jersey Department of Education, New Jersey Department of Health, and more. As we move forward, we'll delve into the specifics of what these numbers mean for the children in New Jersey. Let's take a look at who our children are. The data shows a diverse population with a few numbers standing out. 1 in 4 of the over 2 million children who call New Jersey home are under the age of 5, meaning many are in their most critical developmental years. And most of these children live in married coupled households. Currently, 13% of children in New Jersey live below the federal poverty level, which is set at less than $31,812 for a family of 4. This federal poverty threshold is calculated based on a basic food diet adjusted for family size and inflation, and it is the basis for eligibility for government benefit programs like WIC, SNAP, and the school meal program. This figure underscores the urgent necessity for targeted interventions and support. Recognizing the federal poverty level enables us to understand the many economic struggles families face. Some counties where child poverty rates reach 20% or higher include Salem, Hudson, and Cumberland. Median family income in New Jersey is about $130,000 and has increased across all counties in recent years. But that growth isn't equal, and some counties, like Cumberland and Salem, have median family incomes under $100,000, while others, like Somerset and Morris, are closer to $190,000. And when you compare that to the federal poverty level, it shows that even families above the line can still struggle. That uneven income picture connects directly to food insecurity. A food insecure household has limited or uncertain access to adequate or nutritious food. In New Jersey, over 271,000 children, or about 13.5%, were estimated to be food insecure in 2023, and that number has increased from 263,260 children in 2022. This data are from the data is from Feeding America, who base their calculation on factors like unemployment, median income, poverty, and more. There's also a big difference by county. Places like Essex and Cumberland have rates over 20%, while others like Morris and Hunterdon have food insecurity rates lower than 10%. So where incomes are lower, food insecurity tends to be higher, showing how economic differences impact access to basic needs. School meal programs are vital for supporting low-income students. About 58% of students on free or reduced price lunch are also receiving free and reduced price breakfast, helping them start the day nourished and ready to learn. Families of four earning up to $72,016, which is up to 224% of the federal poverty level, qualify for free meals, which helps ease financial strain. Participation varies by county from 72% in Essex to 31% in Hunterdon, showing uneven access to school breakfast. The breakfast participation rate statewide stays steady from the previous year, indicating ongoing need and opportunity to improve reach. Moving on to some health indicators. All of our maternal and infant health indicators are as of 2023, as this is the most recent data that has been reviewed and finalized by the Department of Health. If you look on NJSHAD, there is newer data available, but it has not been finalized. In 2023, there are just over 100,000 births in New Jersey, and more than a third, or 36%, were to mothers born outside the United States, reflecting the diversity of our state. In some counties, that number is even higher. In Hudson, Middlesex, and Mercer counties, at least half of all births are to foreign-born mothers. In 2023, about 3 out of 4 women in New Jersey began prenatal care in their first trimester of pregnancy. Starting care early is critical as it helps support a healthy pregnancy, monitors the mother's health, and gives babies the strongest possible start. Now let's take a moment to talk about infant mortality in New Jersey. Infant mortality refers to the number of babies who die before their first birthday, and that rate is measured per 1,000 live births. Between 2021 and 2023, New Jersey's infant mortality rate was 3.5, an improvement from 4.1 in the years prior, and that progress matters. But it doesn't tell us the whole story. For Black, non-Hispanic babies, the rate was 8.1, more than twice the state's rate. That gap is not about chance, it reflects real differences in access to care, quality of care, and the conditions families experience before, during, and after pregnancy. These numbers are a reminder that while we've made progress, not all families are experiencing it equally. And that's why targeted supports, culturally responsive care, and sustained investment in communities are essential, so that every baby, no matter their background, has a fair and healthy start in life. As most of you probably know, New Jersey Family Care is New Jersey's public health insurance program, funded by federal and state Medicaid dollars and the Federal Children's Health Insurance Program, or CHIP. Information regarding eligibility can be found at njfamilycare.org. This slide highlights a significant decline in New Jersey family care recipients under age 19. In 2025, we noticed that there were 100,000 fewer recipients compared to 2023. This trend spans all counties, indicating a statewide issue that may affect the health and well-being of New Jersey's youth. It's important to explore the reasons behind this decrease and its implications for healthcare access and policy. Next, this year we've added data from the Children's System of Care, or CSOC, the state division through which parents can access mental health services for their children experiencing emotional and behavioral difficulties. The most recent data as of 2024 shows that there were 122,086 calls to perform care, a 9% decline from the previous year. 63,107 youth had open cases with CSOC, a 7% reduction from the previous year, and 32,778 youth were served by care management organizations, which is stable as what it was from last year. And just a quick reminder to be sure to check out the County Pocket Guide for a full breakdown by county. Now let's turn our attention to the Division of Child Protection and Permanency, or CP&P, which is part of the Department of Children and Families. Out of the 31,148 children under CP&P supervision, a significant 28,129, or 90%, are living at home receiving CP&P services. This highlights the state's efforts to support families within their own homes. The remaining 3,019 children, or 10%, were in out-of-home placements, which involved children being placed with relatives or foster families requiring legal proceedings. From 2023 to 2025, there's been a slight decline in the number of in-home supervision cases, with a corresponding increase in out-of-home placements in many counties. Please check out the Pocket Guide to find details for your county. But these figures underline the ongoing challenges in ensuring that children are safe and families are supported. In 2025, there were 88,762 reports of abuse or neglect. Notably, only 2% of these cases were established or substantiated, as defined on the slide. Over the past several years, the New Jersey Task Force on Child Abuse and Neglect has been examining data regarding the reports of allegations of neglect, finding that over 97% of these calls to the hotline involve issues related to poverty and not neglect. The report Reforming Mandated Reporting in New Jersey was published in January and provides details regarding the work done to develop recommendations for reform. If you're interested in reading the report, you can find it on ACNJ's website. Looking at some childcare data, New Jersey has more than 4,100 licensed childcare centers, but less than half are licensed to serve infants. That means more than half of our childcare system isn't an option for families with babies. This is an economic issue. Infant care is the most expensive to provide. It requires lower child-to-staff ratios, specialized staff, and specific space requirements, all of which make it harder for providers to sustain infant and toddler care options. So what happens next? Programs shift towards older children where costs are lower and stability is higher. And over time, we lose infant capacity. The result is a system that works for some, but leaves families with the youngest children struggling to find care at all. And that's why this isn't just a supply issue. It's a policy and investment issue, one that requires us to intentionally support infant care if we want families to have real options. Moving on to education, chronic absenteeism means 10% or more of the students are missing 10% or more of the school year. In New Jersey, schools must act if at least 10% of their student body are chronically absent. This matters because it's linked to lower academic performance, higher dropout risk, and early reading challenges. In 2023 to 24, about 14.9% of students were chronically absent, with over 60% of New Jersey schools affected. Here's a breakdown by county of schools where 10% or more of students are chronically absent, and we see that there is a range between counties. Morris County has the least percentage of schools where children are chronically absent at 27%, and counties like Ocean and Cumberland have rates of 90% or higher. During the 24 to 25 school year, more than half of New Jersey's third graders were not reading at grade level. The percentage of third graders meeting or exceeding expectations in English language arts and in math on the NJSLA has been improving gradually. On the other hand, almost 60% of New Jersey's eighth graders are reading at grade level, but essentially only 2 in every 10 eighth grader are meeting or exceeding expectations in math. This spring, the Department of Ed will launch the New Jersey Student Learning Assessment Adaptive, or NJSLA-A. It is designed to reduce testing anxiety and encourage confidence by creating a personalized test for every student. If you're interested in more information, please check out the County Pocket Guide for more. Finally, looking at the teens data, in 2023, 2% of births were to adolescents ages 10 to 19, which is the same rate as it was last year. Juvenile arrest rates and youth admissions to county detention did not have a noticeable change statewide, although this varies by county for 2024 data. When breaking data for youth admissions to detention by race and ethnicity, there has been a slight increase in the percentage of Black or African American youth and a slight decrease in the percentage of Caucasian and Hispanic youth between 2023 and 2024. Thank you so much for joining us. If you're interested, I've included the ACNJ's contact information here, and yeah, thank you.
Okay, thank you so much, Alina. That was really helpful. I learned something new every time I listen to you give a presentation. So I want to say there's maybe 60 or more indicators in the Pocket Guide, correct?
Yes.
Yeah, so that, I mean, what Alina showed was the highlights. There's a lot more indicators. You can access it. Echo put a link to the Kids Count Pocket Guide in the chat. All right. So at this point, our next presenter is former Assemblywoman Shavonda Sumter, who served in the New Jersey legislature for 13 years, representing the 35th district in the New Jersey Assembly. And during that time, she sponsored legislation to improve access to health care for all. She is a big supporter of New Jersey family care, of providing mental health services to youth, and is involved in the NJ4S program. And I know a big supporter of CSOC. She also established a commission for violence as a public health crisis and worked to increase access to addiction treatment services. She is currently the president and CEO of Children's Aid and Family Services, one of Northern New Jersey's leading nonprofit providers of services that protect and support vulnerable children, adults, and families. Their mission is to empower individuals, strengthen families, and support healthier communities. And she's doing a wonderful job. Prior to joining Children's Aid and Family Services, Assemblywoman Sumter spent more than 20 years in the healthcare sector and had some of the following positions. She was Associate Vice President overseeing behavioral health services at Hackensack Meridian Mountainside Hospital in Montclair. She was the Director of Business Development at Bergen Newbridge Medical Center in Paramus, where she led and managed growth strategies of inpatient psychiatric hospitals and outpatient services. And before that, she was the Director of Business Development at Summit Oaks Hospital, where she successfully led business growth and integration services. While in the New Jersey legislature, she served on several committees, including Health and Senior Services, Economic Development, Law and Public Safety, and was the vice chair of the Labor Committee. Assemblywoman Sumter is the first woman to be selected to chair the New Jersey Legislative Black Caucus and has been recognized as a global leader participating in international summits on urban sustainability and social cohesion. She's an active member on several boards and a lifetime member of the National Council of Negro Women and the NAACP. We asked Assemblywoman Sumter to share her reflections on the Kids Count data, drawing on her healthcare experience and her work at Children's Aid and Family Services. And I'm hoping she's also going to share some thoughts on what she believes is needed to improve outcomes for children and families. It is my pleasure and honor to introduce Assemblywoman Shavonda Sumter. Thank you.
Thank you, Mary, for that glowing introduction.
You
And
deserve
thank
it.
you.
You deserve it.
I always feel a little shy at all the work that's been done, but it's been necessary, and I had great partners along the journey. Thank you to ACNJ. The Kids Count report was something that I have used throughout my tenure in the legislature to advocate for changes and improvements in the children's system of care. In fact, the Department of Children and Families was born out of Senator Teresa Ruiz, a majority leader working in partnership with me and a number of you to form because we wanted to carve out services for healthy families and children. My life's passion now has come to a full circle fruition being the president and CEO at Children's Aid and Family Services, where I get to work on the things that I'm passionate about daily with over 400 employees serving over 26,000 families in the Northern New Jersey corridor. The Kids Count report today reinforces our need to continue to grind. And I use the word grind because, as you heard from the data point, there is so much work to be done. When we hear that there's over 2 million children that call the Garden State home, that's encouraging. But it means that we must do more to make sure that they have healthy, quality lives that we can help them to achieve their dreams beyond their belief. And it's important that we strengthen and expand public policy to support the maternal and child health data that we heard. We're the second state in the country to expand Medicaid coverage to 365 days postpartum. I can tell you when I was in the legislature and I learned when we were hosting hearings on maternal health that we did not provide coverage postpartum when you need it most after delivery, it was shocking to me. And then to learn that we were the second state to provide it 365 days postpartum when you need it the most once this little one is born to you in the care that's needed. That's one big pressure, trauma, stressor point that relieves families of worrying about healthcare. So creating access, still critical to us today. The Kids Count report talked about supporting the whole person. There's dignity in words. The language supporting the whole person, it's hard for mom or the father to feel safe, healthy, stress-free if they're worried about the health and wellness of their child, let alone themselves. So really making sure that we created programs to support them. The expansion of Medicaid, critical. It is daunting to know that we're rolling back the clock on a number of the Medicaid expansion initiatives that are federally funded at the 50% match across the country, not just New Jersey, is painful. It's something that we must continue to lift our voices up against because healthcare is a right, not a choice, not an option. It also impacts the economy. And again, we want to keep people healthy. And in the United States of America, New Jersey, we should be doing that as a fundamental right. So we got to continue to advocate and lean on our federal delegates to do just that and give them the courage. And our voices matter for that purpose. Another program that was important to me, the state Work First New Jersey Menstrual Hygiene and Diaper Benefits Program, appropriating $2.5 million to the Division of Family Development. These initiatives require funding. We're an expensive state to live in. We hear a lot about affordability from Governor Sherrill. We also heard it from Speaker Coughlin, from Governor Murphy. What does affordability look like for our families? We have to be the leaders who voice those concerns, those challenges and stressors, because they may not be able to get to the executive leadership. The Kids Count report is one way to share that information, and you could pull out pieces of it with your legislative leaders locally as well as your municipal leaders. It's important that they know the impact of what it costs to live in New Jersey for our families. And then providing Work First New Jersey participants and their dependents under 36 months of age $30 monthly to offset the cost of diapers. This was a game changer. At Children's Aid and Family Services, we've operated this program called Baby Basics since 2005, and it strengthens families and supports healthier communities consistent with our mission. Our Baby Basics program has grown significantly since that time, helping thousands of families to keep their babies safe, clean, happy, and healthy. Last year alone, Children's Aid and Family Services distributed over 450,000 diapers, nearly 12% increase from 2023, and it helped 700 families, which is a 15% increase. And this is other agencies across the state also do the same thing. And it's important that we know these are pocketbook issues of providing diapers so that families can have their babies clean, healthy, and safe. For low-income families and those living below the poverty line, which we saw in the Kids Count report, keeping our babies clean and healthy with an adequate supply of diapers is an enormous challenge. According to the latest National Diaper Bank Network check, 47% of U.S. families reported a diaper need. 47%. So while we're doing our part as Children's Aid and Family Services, you have the data from the Kids Count report, there's still more to be done. And unfortunately, federal benefits such as SNAP, food stamps, and WIC, Supplemental Nutrition Program for Women, Infants, and Children, cannot be used to purchase diapers. So support is needed for that purpose. I want to share a couple of testimonials because this is what impacts the work that I do every day and really help to inform the policy systemic changes that were needed in the New Jersey legislature when I was there. Baby Basics has been a lifeline for so many families, and here's a story. I don't have to stretch diapers or worry about my baby possibly getting a diaper rash. I can change him as often as he needs to be changed. It's a more comfortable experience for my baby and a less stressful experience for me. Baby Basics has been a great help. I'm a single mother of 3, and their support has financially and emotionally helped me so much. I am very thankful for all the support. I feel less stress since being a part of Baby Basics because it helps me save some extra cash to use on other important expenses like food, since I have diapers and formula. Now, our Baby Basics program is not just give you a stack of diapers and you walk away. We actually take time to get connected with the moms and dads, and we provide a support peer group for moms and dads who are working hard together. In the pandemic, moms and dads rotated, picking up their diaper packages, and then we added formula. And if there's a generous donor like Bombas, they donate socks, children's clothing, and things of that nature, in children's books. It's a support network for families who are struggling and don't feel alone, because loneliness, another issue for our adults, is a true impact. The other piece I'd like to share on policy challenges, and we heard it in the ACNJ Children's Count report, the flexibility of SNAP in New Jersey. So when we talk about being able to add an additional $30 to support diapers for families, that was just a pilot 1 year. That is not something that the federal government is going to fund. And we know in November there's a cliff where there's going to be a change to Medicaid eligibility for families. We heard here today, and I want to double down on that message, on the enrollment levels and eligibility recertification being a challenge, especially for foreign-born mothers who still need the support. There's no penalty in New Jersey. So we need to share that message, because guess what? The fear mongering is louder than trusted partners such as the individuals on this Zoom webinar. So it's important that you get the facts, you go to the different sources that are put in the chat here, so that you have information that you can share with vulnerable families in communities. And we got to reach them where they are. The one thing I emphasize for government is that we have some great programs, but how do we get that message out to the community? And it's important that we do just that by having meetings and gatherings like this. You heard Mary share that they'll show up in Camden. And it's important that we show up in Camden, and we show up in Patterson, and we show up in Newark, and we also show up in the Oranges and the Irvingtons and the Passaics, so that our folks know in New Jersey, no matter what their status is, that we care about their health and well-being. Also, I'd like to share that the New Jersey Early Childhood Program, growing capacity for slots, the need for child care centers. You cannot, or it's put it this way, you're challenged placing your child in a child care center if you don't have diapers to send with them. So again, being able to have diapers, having donations and support for that expense helps families to thrive, and it's good for the economy. That was one of the arguments that I always relayed while as a policymaker, since we want to balance affordability with the ability to earn, thrive, and raise your family. It still breaks my heart every time that I hear the maternal mortality rates for Black women. In New Jersey, we heard that it's 8.1 times higher for Black women, higher than Asian women, higher than Hispanic women, higher than white women for the mortality rate for something that should be the greatest joy in your life, to have a healthy delivery. We have to continue to amplify the need to continue to work in that space. So sharing that data point, and then looking at ways to improve upon the health, safety, and well-being with our medical professionals, access to health care, access to maternity health, critical. The Nurture New Jersey programs, which was an established partnership with the New Jersey Legislative Black Caucus and former First Lady Tammy Murphy, to build a sustainable strategic plan. A number of you were a part of those work groups. We actually sat together for well over a year to build out the barriers and then talk through the strategies for improvement. There's more work to be done, and I will rest on the fact that we have to be consistent. We have to grow no ways weary and working towards those efforts. And then children's mental health, another passion of mine. I'm an operator of the Bergen Hub through Children's Aid and Family Services of the NJ4S program. That services 1.2 million youth in the state of New Jersey. It took away the inequity, and I said inequity, of being in a rural or suburban district in a public school, charter school, or private school with access to mental health services and prevention programming. Prevention programming is important. As some of you have heard, I've spent over 30 years in healthcare. The toughest part of my job was child behavioral health and seeing a child when they're at that breaking point and they require emergency care and then having to be removed from their family and placed in a inpatient unit. Now, while it's necessary for the care, safety, and plan of that young person and life saving, what can we do before we get to that point? How can we meet them at the top of that cliff? Prevention services is just that. Partnering with our schools, going into the schools with prevention specialists, that's a certified, trained professional to work with our student population and our educational staff to teach them signs and symptoms. We talk about chronic absenteeism. We also talk through bullying with training evidence-based programs. So it's not just a feel good, it's not just an assembly, it's not just a free period for teachers. And I want to emphasize that. We've serviced through NJ4S over 700,000 young people in a year and a half. We have the data to support the work that we're doing, and there's more work to be done. We have 3 levels of services, and if you need clinical services, we remove the barriers of having insurance for 7 episodes of intervention. If you need continued intervention with a clinician, you're referred to a higher level of care. Transportation is also removed because the clinicians can either go on site at the school, meet in a community program such as a library or a family connections, family success center, working with partners. And this is across the state in remote areas from Cape May all the way up through Hudson County. Critical that we build on those systems. We're recognized nationally for this program for NJ4S. Now, are there rooms for improvement? Because it's New Jersey. Of course there are. Do we believe we can do it better? Absolutely. But New Jersey is a stick-to-it state that double downs on efforts, and we're not shy about saying what our needs are. So I want to thank those who are partners in advocating. Thank ACNJ for joining us and saying to sustain NJ4S. And we are happy to complement the program and services with additional resources for those most in need. But I will add this. We also need to coordinate our system, working with Children's System of Care, working with NJ4S, working with Family Success Centers, making sure that there's not a duplication of services, but a connection so families at whatever point of entry that they need, we can connect those resources. That is why I was honored to join you all today for this webinar, because we need to talk more. We need to stay connected. We need to partner more to be sure that we're delivering for all of our families. I would like to leave you with a couple of resources. NJ211.org, another resource that will give you a tremendous amount of information. Family Connects, NJ.org, another service. New Jersey SNAP, you can look them up. Work First New Jersey. 988 New Jersey Hope Line. Please, if you know someone who has a need, even if it's just to talk, that's a resource for them. NJ4S.NJ.gov, another resource. And then if you want more information on maternal health, there's the info hub at info@njmihia.gov. I know I threw those out quickly. I see them popping up in the chat. So thank you to Echo and Mary who are posting them for me. I haven't gotten that good where I could relay out all of this and also type it in the chat at the same time. I'd also like to uplift Children's Aid and Family Services.org. Baby Basics. If you want support, we service Essex County, Passaic County, and Bergen County for diapers and formula for families that are in need. So I will hold it there. I want to really thank you all again for the opportunity, and thank you all for finding it not robbery to spend your time with us this morning to hear this important data so that we can support our children and families.
Thank you so much. As always, you have a lot of wonderful insight, and it just goes to show how much work one person can do, because think about all the contacts and all the work you've done in the legislature, but also in the private sector. So, and I think Echo is definitely better at putting in the links that actually matter than I am, because I'm seeing my typing, but it's not linking. So we will get some of these other resources out to everyone. I don't know, Assemblywoman Sumter, are you, can you stay, answer a couple questions if anybody has any questions? Or
Sure, I have about
okay.
5 minutes if that's okay.
Okay,
Sure.
so if anybody has any questions, and I do apologize because I was looking at questions in the chat and not in the Q&A, so I did type a few responses into the Q&A recently. And I know Alina, she came back on momentarily. I know she put something in the chat that if anybody would like to have a community conversation and hear more about data, they should contact her at asidiki@acnj.org, and we can schedule that. I'm just looking to see if I'm seeing a lot of thank yous. Assemblywoman Sumter. I'm not, but I'll give it another minute to see if anybody has any specific questions. More thank yous. Very helpful. Appreciate all you do. Great information. So as I understand it, I think we will take the other questions regarding the data and we will compile some answers and then also put in all the links, Assemblywoman, that you gave us, and we will send that out to everybody who was registered on the Zoom. And as I said earlier, people can access the Kids Count data book. It is at the ACNJ website online. Just go to the main page and you'll see a link in the banner. And then we will link the presentation that Alina gave later today. And then we will be, and Echo already put another link to the pocket guide in the chat, but we will also have the recordings downloaded and then put on the website either tomorrow or the next day. So they'll be accessible. Okay. Well, thank you all. Thank you all for joining us. We appreciate it. Please share the Kids Count data with people, as Sue Flynn mentioned. And I want to thank my board vice chair, Sue Flynn, for joining us today and providing the introductions. I know she's still here somewhere. So thank you, Sue. All right. Thanks, everybody. Thank you, Assemblywoman. We'll be in touch. Thanks, Alina.